Hi, folks. It's Joe here from Seniors Need to Know. We have about 60 million people in this country over the age of 65. That's about 18% of the population. In 5 years, it's going to be 1 out of 5 people. It's the fastest growing demographic we have in the country. And it's a real information desert for seniors out there. They don't have a lot of information on how to live healthy and how to live long and how to live healthy and long at the same time, which is our goal. So we're trying to give you some facts today to help you navigate this. My guest today is Mario Bick, who's an expert on Medicare, which is our subject for today. And he's been doing this since 1989. So he's going to take you through how to evaluate Medicare from start to finish. And we're not trying to sell you anything here. We're going to talk about Medicare, Medicare Gap or supplemental Medicare, or Medigap, I guess you call it, and Medicare Advantage. And there are pros and cons to both plans, both to Medicare and Medicare Advantage. We're trying to give you some tips now to make a decision, because the period where you're going to be bombarded with information and commercials, whether you're a first timer or someone who wants to switch plans, this will give you some really useful information to make the right decision for you. So the enrollment period is kind of on us. It's coming up. When is it coming up, Mario? October?
So the enrollment period for Medicare Advantage starts in October 15th, actually.
Okay, good. So we're coming up on it. So Mario's going to explain initially now the difference between Medicare, traditional Medicare, and Medicare Advantage. So I'll turn it over to you, Mario.
Well, first off, thanks very much for having me, Joe. I really appreciate it.
My pleasure.
One of my favorite things to do in the insurance world is to help seniors with Medicare. You can make a lot of mistakes. So I hope by the information that we share with your audience today that they'll be avoiding a lot of those mistakes.
Right.
So I'll start out by explaining basic Medicare. If you ask somebody, what would be the perfect health plan? I think the two things that would be recurrent in their statements would be that it's affordable. And the second one would be access to physicians, hospitals, and all of that. The beautiful thing about what's known as original Medicare, which is where we'll start, is that for what you get, it's very reasonably priced. But more importantly, in my opinion, is that there is no network. It's not like what we're used to while we're under 65. Nothing against any insurance company, but they all have networks.
Sure.
With original Medicare, there's no network. Once you're on original Medicare, you can go to 100% of every hospital in the country, 100% of every testing facility in the country. And I looked it up on Google. 98% of all non-pediatric doctors, we're not interested in kid doctors,
right,
take Medicare. So that means that as we get older and medical stuff starts to happen, we have access and we decide what our care will be. So Medicare has 3 parts to it: A, B, and D, and I'll quickly go over them. Part A has to do with hospital charges. And if you're confined to the hospital, during the first 60 days of a confinement, the only thing they will pay out of pocket in 2025 is $1,676. If you stay longer than 60 days, and I know people say that never happens, it actually does.
Right.
You would be paying $419 per day. And then if you were unlucky enough to stay between 91 and 150 days, you'd be paying $838 a day. And after 150 days, you're on your own. Medicare doesn't pay anymore. But later in the podcast, we'll talk about what's known as Medicare supplements or Medigap plans, and they cover all those charges.
Right, right.
The good thing about Part A is that it costs $0 if you've worked and paid into the system through your FICA taxes, your payroll taxes, for 10 years or longer. So that's a very nice benefit.
That's the hospital piece.
That's the hospital piece, right? That applies for the hospital charges.
Okay.
Then we move on to Part B, which covers many things, namely, to start, doctor services, physician services. Whenever you use the services of a doctor, their bills are going to come through Part B. A is only the actual hospital charges. So if you go to the hospital for surgery, you're there for 3 days. The anesthesiologist, the surgeon, and any other doctor to visit you while you're in the hospital, their bills are going to come through B, not A. Then you have outpatient care, urgent care, emergency room, Or if you go to the hospital outpatient, in and out the same day, it's all covered by B.
Hmm.
Next is testing. We're talking about MRI, CAT scans, PET scans, lab work. And again, you can go where you want to get these items done. And the last category I'm going to mention is, they call it supplies. People are very familiar with CPAP machines. If you're a diabetic, you need a Dexcom meter, you need your syringes. Or let's say you fall and you break your leg and you need a walker. It's durable medical equipment. All these items are covered by B. And the way it works is, the first time during the calendar year, this again, 2025 numbers, there's a deductible one time a year of $257. After that, the government kicks in and pays 80% of the rest of the bill, and you're responsible for 20% of the rest of the bill.
So you said 257 is that a monthly charge, or
That's a annual deductible, one time a year.
one time a year on Medicare? Okay,
Right.
got it.
Now, Part B does cost something,
Right.
and it really depends upon a person's income. The base premium in 2025 for Medicare is $185,
Hmm.
which is extremely reasonable for what I just described.
That's monthly.
That's a monthly charge.
Right.
That's correct. But there's something called an IRMA charge. It's an income reconciliation Medicare adjustment amount. It's a federal law that they started years ago when a lot of us baby boomers started joining Medicare and they had to raise money.
Right.
And without getting complicated, the higher income that you earn, the more you pay. So just to give you an idea, if you're a single person filing a single tax return, if you earn less than $105,000, you pay the $185. If you earn over that, then the numbers start going up the higher income you are. And if you're married filing jointly, if you and your spouse earn $210,000 or less, you pay $185. And if it starts going up from there, you pay more. I'm sure this chart that I have will appear on the screen,
So-
and people can look at that.
Yeah. So most seniors will be paying 185.
That's right.
Okay.
That's right.
And those lucky enough to earn more than 105 or 210 will be paying. How much would they be paying?
Well, there's many categories. There's actually 5 buy-up categories. It ranges from $259 a month as opposed to the $185.
Right.
$259 a month all the way to $628
Okay.
per month.
Okay. So it's progressive that way.
That's right.
By income. Okay.
That's right.
Okay.
That's right. So that's the basics of Medicare, except for the last part, which is called Part D as in David, which stands for drugs, prescription medications. So what the government has done is they've allowed a certain number of private companies to create these called Part D plans.
Right.
And Medicare.gov has a tool that you can literally go in there, put your zip code in, put your medications in, put your dosages in, and your pharmacies, and press a button. And let's say that your state has 15 plans available. It'll list all 15 plans, and it'll show you what the premiums are, because the plans do differ. They're all designed similarly, but they do differ in their cost, their premiums.
Right.
But the biggest difference is how much they charge for a particular medication. So the only metric that I would use when it comes to Part D is cost. Not necessarily, there's not one plan that's better than the other. They all do the same thing. But if you can get your medications for $200 a year on one plan, and the other plan is $1,000 a year, there's really no reason not to choose the $200 plan.
Right.
And and the other thing that the government does is they recognize that people's medications change from year to year.
Right.
And they also recognize that these formularies and the prices of these plans change year to year. So there's an open enrollment period for Part D every year that every American on Medicare can use. And that is between October 15th and December 7th. Those dates are crucial.
Right. So this is for the prescription plan, October 15th
through December 7th.
All right. So you have to sign up your plan unless you want to continue with your
right. If you take
plan.
No action,
yeah.
Then they will re-enroll you automatically in the same plan, but the same plan may have changes for the next year.
Right. So to kind of summarize what you said about A and B, A is the hospital plan, 257, and then the progressive premium monthly premium for the doctors. It looks like if I'm an average person making under 150, 105,000 or 210, if I'm married, it's probably like 2,500 a year for me for plans A and B added up.
Right.
More or less.
Right.
That's what it's going to cost me on Medicare.
That's correct.
And then on top of that, I have Part D, where I may be charged a monthly premium.
The premiums go from 0 to 150 per
Yeah.
month,
So,
depending
okay.
upon the plans.
Right. So let's say I'm paying, $40 a month for a plan. So that's another $500 there. So that's I'm up to 3,000 now. And then there's a deductible on top of that, right? For my meds.
Oh, only for expensive meds.
Okay.
Most of America they don't even use the deductible. There's a lot of expensive meds out there.
Right.
But most of us take the basic blood pressure medication, the cholesterol medication, things of that nature.
Minimal. Yeah.
Minimal. Those are inexpensive.
So it's probably somewhere around 3,000, 3,500 a year for most people for Medicare. This is for Medicare.
Right, right.
All right. And now there's a site for Part D. We're going back to the prescriptions again. You can go on, because you always remind me every year to do this, to have my plan evaluated as to the other plans that may be available in my area where I live,
right,
to get the best plan. And
that's Medicare.gov.
Medicare.gov, and the government does that for you.
Right. And by the way, once a person enrolls into Medicare,
yeah,
they can actually create a username and password for Medicare.gov.
Right.
Or you could do it as a guest, but if you do it as a guest, you have to re-enter your meds every year.
Yeah, yeah.
If you do it with a username and password with your own login, your meds stay there. So the next year you can either delete a med, add a med, change a med, whatever you want to do. It makes it very easy.
Okay. So one other thing I wanted to mention about Medicare as well is if there's an issue, they don't do electronic payments. If I go to a doctor and I actually pay out of pocket, and he submits the form to Medicare instead of just covering himself, they mail you checks. They don't do electronic, and I just found this out recently that
it could go that way, but what happens is 96% of all doctors, Medicare has a wonderful billing system, amazing, and the doctor's billing office handles it all. There are 4% of doctors that don't participate in the Medicare billing system, without getting it complicated.
Okay, that's good.
But 96% of doctors, there's nothing that you have to do.
You don't have to do anything.
You don't have to do anything. The doctor literally will get a statement from Medicare showing that you've met your deductible and this is what you owe. And if you have a supplement plan, which we can talk about shortly, the supplement pays them and you end up paying zero.
Right.
Once you hit that $257 out of your pocket.
Right, right. Okay, so we've gone through Plan A, hospital, and what the deductible is, what my costs might be if I'm the average person for Plan B, which is the doctor plan, and then the drug plan, which is minimal to charge on the most generic drugs or most drugs that seniors take, with a maybe small charge monthly for the Plan D. Okay, so now we're maybe up to $3,500 a year. I'm looking at this at Medicare, and I'm saying, okay, I'm getting all these advertisements from Medicare Advantage, and the premiums seem really low. I mean, some of the plans are for Medicare Advantage, and this is the choice we have to make here, is maybe zero premium against maybe $3,500 I'm paying under Medicare.
Actually, just to be clear, the charges that we discussed so far, the Part B charges,
right?
No matter what way you go in Medicare, you got to pay those to the government.
Right.
And then once you join Original Medicare, you have a decision to make.
Right.
You either go Medicare Advantage, which we'll go over.
Right.
Or you stay on Original Medicare and you get a Medicare supplement or a Medigap plan. There's the same terminology. They're synonymous terms.
Right. And I've read that almost 90% of people go with a Medigap or Medicare supplement plan when they go on Medicare.
I don't know the exact percentages, but let's, for argument's sake, call it 50-50.
All right.
Okay.
So staying on traditional Medicare now, why should I get a Medicare supplement plan? Because that's another premium that I have to pay.
So as I mentioned before, the beautiful thing about Original Medicare is that the costs are reasonable, which we've covered.
Right.
And there's no network. It's an access to care issue. You have total control.
So it's not like an HMO or a PPO.
No,
where I'm
there
stuck
is
in
no network.
There's no network.
Nowhere. You go anywhere you want. It's very easy to use. But as I mentioned before, you have those deductibles, the $1,600 if you go to the hospital, or if you stay longer, $419 a day, $828 a day.
So if something happens, I'm out of pocket.
If something happens, you're going to have to pay some out of pocket.
A lot out.
Right, including the 20% under Part B. I mean, you go in for the surgery, and then the surgeon's fee is $10,000, it's going to cost you
So
$2,000.
Medicare only pays 80% of that. Yeah,
Exactly.
got it.
So when Medicare started in 1966, the insurance industry, together with the government, created Medicare supplements. And there are all these different Medicare supplements. The most popular one is called Plan G.
Mm-hmm.
I think if your audience would speak to their friends that have Medicare supplements, well over 90% have Plan G. So we'll just focus our discussion on that one.
Okay.
Just for
And we're going to go
argument's
over the
sake.
alphabet soup later on in the.
Okay, we'll review all these things.
Yeah,
That's right. So a supplement is issued by a private company for a separate premium.
Mm-hmm.
Plan G, just to give you a ballpark, in South Florida will cost between $250 and $310 a month,
Mm-hmm.
depending on your gender and your zip code. And Plan G will cover everything we just spoke about pertaining to A and B, all the gaps. You won't pay anything out of your pocket except for that one time a year $257 deductible.
Right, because it's covering the 20% of the doctor's fees that the Medicare doesn't pay,
And the deductible for the hospital.
and all those deductibles you talked about,
Except for the
hospital stays.
257.
except for 257.
Got it.
So all you got to pay is 257 if you do Medigap
That's right.
or
That's
Medicare
right.
supplement.
That's right. And Plan G.
Plan G.
So the benefit is obvious. You get great coverage and you don't pay anything out of pocket except for that $257.
Right.
The drawback is that you got to spend approximately an extra $300 a month on a supplement.
Right.
That's the drawback.
Right.
So there's another way to go. And you see a lot of advertising during open enrollment for Medicare Advantage programs.
Right.
So what a Medicare Advantage program is, it's a program that is put together, again, with the blessing of the government, by private companies.
Mhm.
Aetna, United Healthcare, Humana, there's a long list.
Right.
And these plans are networked plans. Some of them are HMOs, some of them are PPOs, some of them require referrals, some of them don't require referrals. They're all different types of plans. But when you sign up for a Medicare Advantage plan, a few things happen. Number one is you are no longer covered by Medicare. The government is transferring the responsibility of your health care to this company that you just signed up with, and the government pays them a fee, a substantial fee
To cover you.
to get them off of their rolls and right, to cover you.
Okay.
Exactly. So they're a for-profit organization. And the other detail about Medicare Advantage plans is the prescription drug plan, the Part D, it's embedded in your plan. So my advice to people that decide to go with Medicare Advantage plans is make sure that your doctors are in the network,
Right.
and also make sure that your prescription drugs are covered at a reasonable cost.
Right.
So you got to do your homework. You have to go with an independent agent to shop that out.
Right.
And you need to do that exercise every single year to make sure that you
Sure, because
you get the
doctors
right-
retire and
all the time.
Yeah.
Exactly.
yeah.
The positive so the negative is what I just mentioned. There's a network,
Yeah.
and it's a for-profit company, but the positive is that most of these plans charge zero premium.
Right. And that's
Now
that's a big plus.
That's a big plus. You still have to pay the government their Part B, the 185 plus. That's the price you pay to play.
Ah,
Whether you go to Medicare Advantage or you go supplement, you still have to give government their share.
when you say the 185 plus, is the Part B,
And the income charge, higher income individuals pay
Part
more.
B premium just to access the doctors that are in the network
Right,
for Medicare Advantage.
right. To join an Advantage plan, you have to be on Medicare.
Okay. Okay.
You're on Medicare,
Right.
but once you're on an Advantage plan, Medicare is not covering you.
Right.
It's basically an access gate to the Advantage plan.
I see. Okay. So the advantage to Medicare Advantage is zero premium to join. You still have to pay the 185 Part B monthly supplement
Not supplement, Part B premium.
Part B premium, to stay in the program, and your Part D prescriptions are covered.
It's inside the plan.
It's inside the
embedded.
plan.
Right.
Okay. So this all sounds pretty good. It's a little cheaper than Medicare.
Right. So just to full disclosure, these plans, they do have deductibles. They do have copays. They do have max out of pockets.
Okay.
And then the other thing is, because of what you mentioned a second ago, that the Part D is within the plan, it's kind of hard to choose. There's a lot of Medicare Advantage products out there. It's going to be tough to find a plan that is optimal, meaning it covers all your doctors at a low cost and it covers all your prescriptions.
Mm.
There's 14 different prescription drug plans on regular Medicare. Um, so the chances are roughly one in 8, 1 in 7 that
Right.
you're going to have the most optimal prescription drug plan.
Right.
And that's even people on regular Medicare, I see them making the mistake. They don't shop out their drug plan every year.
Mm.
And I can tell you stories where people have been paying literally $2,500 a year for a certain sets of medication, where they would pay zero if they had the right prescription drug plan.
Right.
And they've just been throwing away $2,500 after tax for X number of years.
Wow.
So you gotta search every single year.
Now, for my doctors, let's say my doctor's in the network, and I guess that these are operated like HMOs or PPOs, similar to private insurance.
That's
So
right.
my doctor's in the network, and my primary doctor's in the network, and I have a problem, a specific problem that needs a specialist. Now, that doctor has to refer me to the specialist to get covered, or
Some plans do require referrals.
yes,
Some don't.
okay,
The bigger question is the doctor that you want to go to in that network?
right.
You don't know.
So that's why you have to every year you have to check your doctors to make sure that you're covered.
That's right.
So it may be a little cheaper, but then again, it seems to me to be a bit more work.
Right. I would say that the better option to go, there definitely is a market, and Medicare Advantage plans are right for a certain segment of our population.
Yeah,
But if someone can go ahead and their budget allows to go the Medicare supplement route, they'll have greater access to care,
right.
and it'll be a smoother ride.
Right. It sounds like if you're a really, really healthy person and your doctors are in the network and you're pretty satisfied with your doctors, you might be better off going with Medicare Advantage just on the money side. But if something catastrophic happens to you and you need a specialist for some reason, you got to be careful that that specialist is in the network.
That's entirely accurate. And here's the problem, though. You can't be bouncing back and forth.
Hmm.
So when a person first applies for Medicare and they're on Part B, A and B mostly,
Hospital doctor, yeah.
right. Once you're on Part B, it's called your initial open enrollment. You could choose any plan you want. They don't care about your health. There's no medical underwriting. You can just pick a plan and choose it. No medical questions.
Right.
But if you start out with an Advantage plan and you decide that you want to leave an Advantage plan and go to a supplement, if you do it within the first year, you're okay. The government gives you like a trial period, it's called.
The first year
First year.
you're in a program, whether it's Medicare.
The first year you're in an Advantage
program.
You can go ahead. But if you stay in an Advantage program greater than 1 year and then you decide you want to switch to a supplement plan, they're going to ask you medical questions. There's 10 medical questions that are pretty standardized amongst all the Medicare supplement carriers.
Right.
And if you can't answer no to all those questions, you're going to be stuck with the Advantage world.
Oh, you're not going to be able to get a supplement.
That's
Point.
right. That's what I'm saying.
Okay.
So that's why you have to really make a good decision in the beginning.
Right.
This is all about making good decisions early.
Yeah, this is complicated for seniors to figure out because we're bombarded with commercials about Medicare Advantage.
I just turned 65. The mail, the calls that I got, it was crazy.
Now, does Medicare Advantage also have dental and vision?
Yes, that's another advantage
Yeah.
to the Advantage plans.
Right.
They do have a dental and a vision program embedded in there. Whereas supplements in Medicare, they don't cover your basic dental work. They don't cover your basic vision, your eyeglasses or your contacts. They do cover cataracts or problems, retinal problems or vision medical issues, but not your basic eye exams and your glasses and your contacts. So that is covered by these Advantage programs.
Oh, the Advantage plan does cover the cataracts.
Yes. Everything covers cataracts. I'm talking about your eyeglasses.
Oh, your
Medicare doesn't cover eyeglasses. The Advantage plan will.
Okay, got it. So it's kind of like minimal vision and dental care.
Right. It's a basic dental and vision product.
Okay. So what are the deadlines to sign up for Medicare and Medicare Advantage?
So the enrollment periods are as follows. The first one obviously is when you turn 65.
Right.
You can go ahead and apply for Medicare, which is the first step always in this process, no matter what you decide to do. You can apply 90 days before your effective date. Your effective date is the first day of your birth month. So if you were born on November 12th, you're going to start on November 1 if you choose to.
Right.
And you can apply 90 days beforehand. And there's two ways to apply. The old style way is to make an appointment with the Social Security office, go in there and sit down with somebody and they'll apply. But it takes so long to get an appointment. Today, really, I would guess well over 90% of applicants apply online.
Right.
And you have to create an account at ssa.gov, which is the Social Security website. You do not apply for Medicare through medicare.gov. You apply through Social Security Administration.gov.
Ah.
Okay?
Okay.
And then once you apply, it takes between 2 weeks at the shortest period of time, sometimes as long as 2 months to get approved. That's why I would urge everybody to apply as soon as they can.
Right.
For Medicare when they turn 65. Now, you don't have to apply. There's a misconception that says if you don't apply for Medicare when you turn 65, you get penalized. That's not true. Let's say that you are you're working
Right.
and you love your group health insurance and your employer is a great employer and they pay 100% and you've never had any issues and you want to stay on it. There's nothing that says you have to get off of it.
Right.
The problem is that if you end up applying for Medicare 6 months after you turn 65, and you don't have what's known as credible coverage. You don't have that health insurance that the employer provided you. Then you may be facing a penalty. And the penalty is 10% of the 185 for every 12 months that you didn't apply for it.
Ah.
So let's say a person had an individual policy. That could cause you problems as opposed to a group insurance policy. Let's say I don't agree with it, but it's the fact. Let's say somebody's on COBRA. And they decided to stay in COBRA, figuring, when COBRA runs out, I'll sign up for Medicare. Bad decision. COBRA is not considered credible coverage. You're going to pay a penalty.
Oh, so I leave my job and I stay on their plan under COBRA, and they may have even subsidized my COBRA, but if I stay on longer than how 12?
6 months after you turn 65.
So
that's your enrollment period.
Oh, so if I quit my job and I'm on COBRA for more than 6 months after I'm 65, then I'm penalized.
You could be penalized. That's
wow,
correct.
That's good to know.
That's correct. And a lot of people don't realize it.
No.
They don't realize that. So the next time that a person can enroll is, because you can't just enroll when you want to, is open enrollment. So there is an open enrollment for Medicare. That open enrollment is every January for February 1st, every February for March 1st, and every March for April 1st.
Okay.
Those 3 months you can enroll. You may have to pay a penalty, you may not, it depends on your situation, but you can enroll. Now, the problem is that you can be very responsible. You can submit your paperwork to enroll on January 2nd or do it online on January 2nd. But what if you don't get notification till a month and a half later?
Right.
What do? You're walking around thinking that you don't have health insurance. Well, they'll honor everything. It'll be issued for February 1st, but you may not get your card. You may not get your Medicare ID number.
Right.
So it may cause you temporary problems until you get that information.
And these are the people that are coming off COBRA.
That's one example.
Yep.
Or people that stayed on an individual policy to the end of the year, not realizing that they should have applied for Medicare.
Right, and they're over 65.
Or people, I've been in situations where people just didn't have insurance. They didn't bother to.
Wow.
Yeah.
What about if you signed up for Medicare Advantage because and it was a pretty good deal for you for a year or two, whatever, and all of a sudden you say, maybe my circumstances have changed, my doctors have moved, they've retired, or I see something happening with myself that it could be, a problem in years. I need specialists, and I may not be able to get into the network of specialists I need, or the specialists are in another state. I may have to go to the Mayo Clinic or whatever. So I want to get off of Medicare Advantage and go into Medicare. What's the deadline, and how does that process work?
So the deadline really is 1 year from starting Part B. If you stay on a Medicare Advantage plan for more than 12 months since you initially got on,
right,
you're going to have to answer those medical questions.
For the supplement.
If your motivation to get onto a supplement is because you're experiencing health conditions,
right,
then you're in trouble.
Right.
So that person would have to go ahead and reshop during open enrollment for a Medicare Advantage plan. So the government allows you to switch from Advantage plan to Advantage plan to Advantage plan every single year during the same open enrollment period that I mentioned before, October 15th to December 7th for January 1. So every year, January 1, a person could switch their Medicare Advantage plan, but you can't do it in the middle of the year.
Switch their Medicare Advantage plan to another plan or to Medicare.
No,
No.
oh, that's another thing. You can go back to original Medicare
Yeah, that's what I mean.
without a supplement, though. Remember that once you're 1 year removed,
Right.
you have to go through the medical underwriting.
Right. And you may or not make it.
Right. So if you don't make it, you still can stay on regular Medicare and pay all those expenses that Medicare doesn't pay out of pocket, your deductibles and your 20%. That's an option as well.
Right. Okay. We're going to take a break here and we'll come right back with part 2 of this interview.
Great.